What's the story behind association management and how you kind of got started with that?
Growing up in the DME industry, I had so much passion for it. And then one day I had a job and the next day I didn't.
Can you kind of just tell us a little bit of what state association does and why it's so important for our industry?
So much of it is the networking piece of it. I mean, you see it at shows from a vendor to a provider standpoint, but we get to see it in terms of whether they're down to the state level, insurance committee meetings where they're sharing information in terms of what they're struggling with and how are you handling different things.
The industry's so different from when I first started that Medicare used to be our biggest problem. Now it's all at the state level and managed care and Medicare Advantage and all this stuff.
All right, Rose, Jim, we are live on the Claim to Fame podcast. Thanks for joining today.
Thanks for having us.
Yeah, it's great to be here.
Welcome.
Right on. So for everyone who doesn't know who you guys are, I know most people in the DME space probably do. You're in a lot of our inboxes on one email address, which we all love. But can you tell everyone what you guys do and who you are?
Sure, I'll go ahead and start. Again, my name is Rose Schaffhauser. I'm the executive director for MAMES, the Midwest Association for Medical Equipment Services. We're a DME association, a regional association that we have Iowa, Kansas, Minnesota, Missouri, Nebraska, North Dakota, South Dakota, and Wisconsin. I've actually came from this industry. I was a general manager for a DME company back in the late 90s. So, basically grew up in the DME industry. So now I get to do all the things I love doing in the DME industry, but I don't have 170 employees and a $17 million budget. So.
Right on. You guys have been working side by side for decades, it sounds like, right? So what's the story behind the association management and how you kind of got started with that?
Again, growing up in the DME industry, I had so much passion for it. And then one day I had a job and the next day I didn't. And so they were going in a different direction. It was a hospital-based company and they were selling to a national company. And I had always dreamed of I was a volunteer for our association for many, many years. And I always said this would be such a great job where I could just do all my volunteer work, and actually get paid for it. But then when I actually decided to start the company, it was one of those things going, okay, well, I used to have people. I used to have 2 secretaries. I used to have a pretty big staff, and then there was only me.
Yeah, now she has me.
Lucky
her. Did you guys ever, I guess, when did you guys first get involved with MAMES, and how much has it grown since then?
It's pretty incredible. I actually got hired and started my company basically 2 weeks after I was out of my HME company. So I kind of was flying by the seat of my pants because it happened so quickly, because MAMES was looking for an executive director, as was the Minnesota Association, which they were separate from the Midwest back. Now this is 25 years. And so basically what we did is Jim joined about
20 years ago.
Yeah, 20 years ago. And literally we were, everything's manual process. I used to do a newsletter that was 1-page fax, and I would change the font to either make it fill up the page or get it really small so I could fill up that page, versus now I have to scale back and, try to limit what's going on. So I've never would have dreamed that we would be where we are today when I first started.
Yeah, it's been incredible. I think I've been going for at least 6 years now. So I think I'm up to at least 10 MAMES under my belt between the 2 shows. So, but for those I would say for our listeners who are maybe newer to DME, or, if unfortunately have not yet heard of MAMES, can you kind of just tell us a little bit of what like a state association does and why it's so important for our industry?
Well, I can just talk about a little bit of it and then turn it back to Rose. But, so much of it is the networking piece of it. I mean, you see it at shows from a vendor to a provider standpoint, but we get to see it in terms of whether they're down to the state level, insurance committee meetings where they're sharing information in terms of what they're struggling with and how are you handling different things. I think that's a huge piece of it. And MAMES is a little bit unique because of the geographical spread that, we used to see a lot of kind of closed doors. Nobody wanted to share that information of how they were doing things. But the difference at MAMES is it's gradually gotten even better and better at the state in-house state level. People started to share because it wasn't their direct competitor down the street, and then they built relationships with that competitor down the street. And now they're actually talking about things. I think that's probably the big piece of it for me that I see, but then I get to see it on a daily basis because we literally share an office, and I get to hear Rose talk from an expertise standpoint where a provider can call in with a question, remembering that, Rose basically grew up in the industry. When I met Rose 38 years ago, she actually worked for Medicare. So, the expertise, the knowledge that's available, it's unique here because Rose came from the industry, but it's available in any state association, I think. And that's where the critical piece of it comes into play as far as I'm concerned. And that all starts with the ability to now work with everyone from associate members and partners like yourselves to the other DME providers across the country.
Rose, in your MAMES video, you talk about advocacy and community being central. Why is that so important in today's environment?
Well, since we're such a small industry, we have a voice that's not very big, unfortunately, and it's usually, a small percentage of people that get active and engaged. So we take our role very, very seriously to really educate what it is that they can get accomplished if they do that advocacy, if they reach out to their state representatives and their federal representatives and even the other contracts that we have within our company is we work with all 4 Medicare jurisdictions, and we've made tremendous changes in policies and getting policies clarified. We've been able to literally turn on provider numbers again because we also work with the national provider enrollment contractors. And so we've established that relationship where they, meaning the contractors, trust that our members are the ones that, really do their job. They do a great job. They're, compliant. They're, following all the rules. Their main thing that everybody that's involved in the associations and the councils is because they want to do things right. And our contractors know that. Our state legislators, our federal legislators know that these are the people that, literally are responsible for keeping people in their homes, in their communities, and saving the government money.
Absolutely. That's insanely important. I think we're doing a podcast with AA Home Care as well. So I think that'll be great just to keep spreading the word. I know they're part of all the associations as well. And the advocacy is extremely important. It's also incredible probably how many people you've been able to help over the years. What are some of the biggest challenges you witnessed? People pick up the phone and they call their state association. What are some of those just kind of big themes or topics in regards to challenges that you've seen over the years?
Well, I think there's a couple of them. An example is the Medicare provider number. I had a member, we also cover the Southwest Mesa, which is Arizona, New Mexico, and a few Texas folks. We had a member in New Mexico that literally they had gotten their number turned off, had done everything they were supposed to do. It was in like 45 to 50 days. They still hadn't gotten their payment. Well, literally it picked up the phone, sent emails and whatnot. And 2 days later, they had their number reestablished. And it's things like that going on. I love what I do. And then just last week.
That's what I mean.
Yeah. And just last week, Minnesota Medicaid changed a pretty big policy in requiring an ATP to do power operated vehicles. And so I sent our contact at Minnesota Medicaid and said, where did this come from? Well, long story short, he came back and he said, well, we got, feedback from providers. And I said, you may have gotten feedback from some providers, but what's happening is your small providers, they can't afford to have an ATD. So it's going to impact access to care. They changed their policy in less than an hour.
Wow. That's impressive.
Yeah, they came back and said, we just didn't realize it. Thank you so much for bringing this to our attention. We don't want to limit access to these items. As long as they're following policy, we'll change it. And they just sent out the update a couple days ago. So that was really, really, really cool.
And that just goes to show how important it is to have these state associations and these resources for the providers. Kind of shifting gears a little bit, you guys are kind of like an iconic duo. You're not only just sharing the same email, but, working together on a day in and day out basis. What's the secret to, working with your spouse and, having this much success? And there's a lot on you guys' plate. So I'm sure our viewers, how do you make it all work together? They'd love to hear.
Stay in your lane. In your lane. As long as we don't cross over and kind of step into each other's areas I don't have the expertise to get in too much trouble on Rose's side, but I might get a little wound up when Rose starts going into associate member, registrations for stuff and I think it is. That's been the key piece of it is we have two very distinct roles. Rose is the expert in the DME industry. I handle, the membership and the associate member side and the shows and those types of things. So we've got two very different roles and backgrounds. Yeah. I don't come from the DME industry, and I think that's what makes it work. And, we get along pretty well. So,
yeah, I think everyone will agree to that. Jim, what'd you do before this?
I actually did a couple of things. I spent about 10 years in the fast food industry running multiple different restaurants for Burger King franchisees. I did the same thing when at one point I was running about 40 Jiffy Lubes across the upper Midwest. So I did a lot of the service management side of things. So the business standpoint for me has always been pretty easy. So I do all the books, I do all the financial statements, I do all the budgeting for MAMES and all of our contracts and things like that. So
let me ask you this. Who picks the theme of the party each year?
It's a joint effort. Mainly it comes from me, I'll admit. But we did have our last fun one, the MAMES stock. And actually we had a board retreat up here in Duluth, and we were all on a train, and Minnesota had just passed their legalizing marijuana, and one of our board members goes, "It's MAMES stock."
That's perfect.
That's perfect. Yeah, it's great.
But I think it's interesting that you mentioned the parties and the themes of the parties, because I think at shows like that, and we talk about networking, the theme is one thing, but it's the I'm trying to throw the attitude or the starting off the event with a fun get together, let your hair down, go a little crazy, and you put a cowboy hat on somebody and all of a sudden they're not afraid to talk to anybody.
It really does. People let their guard down when they're wearing a costume, for sure.
Right, exactly. And I think it sets the tone for the entire event. We do that on the very first night, and it sets the tone for the next day, which can be a long day of it, great education, but it changes the feel and the vibe. And I think people learn a lot more and when they're willing to talk to people and when they're having a good time doing it.
And there's many times when we've had brand new members there that have never been to a show. So we really try to get our board members to hey, seek them out, make sure they have some fun. And, we're always trying to wrap those folks in early on. And so that kind of just sets the tone for the rest of the event, that they're like, oh, hey, what about this? Or what about that? And the feedback we get from first time attendees has been amazing.
Yeah,
Right.
I remember. I think every year for the last couple of years, you guys have broken the record for attendees, and now you're getting people from all different states. Is it?
Yeah.
Are we still trending in that direction? Are we going to get a couple more states this year? Hopefully, more people. You're gonna have to get a new space soon. I don't know how much more we can handle.
Right?
You know, we're in the middle of
Yeah.
registration right now. It's going pretty well. Our display halls are filling up really super fast. I get registrations every day for the fall event coming up in October 1st through the 3rd here in Minnesota. So, you know, we're hopeful that that trend will continue. But I do think one of the other things that comes out of those shows, especially for the newer folks who come to them, is that participation in the show translates over to participation in other things. So they get to meet, you know, people from Minnesota, and they understand that, hey, we have a Minnesota Legislative Committee. Now all of a sudden they're joining that committee, or the Iowa Insurance Committee, or the Kansas, you know, Medicaid group. And because they join and they network with them at a show, now they're not afraid to jump on a Zoom call and participate in those types of things. And I think that's why MAMES continues to be successful, that more and more people are getting involved from a variety of different groups and different organizations.
And I can tell you just from the staff level of up to their management, sometimes the management, staff, I'm going to bring more staff. So the staff comes and they're like, I'm begging every year to come, you know, and that's been very helpful because for a very early on, it was just management, you know, and then once the staff got involved and they were engaged, then, you know, I want to learn more, give me more. And the management's going, cool, let's do this, you know.
We're gonna. I don't know if you know, but Alex is a big party guy also. So we're gonna have to get him out to one of the shows. He actually planned the whole MedTrade party that I saw you guys at. So
Oh, that was so much
Yeah.
fun.
Yeah.
Well, glad.
Right.
Yep.
yeah,
Glad
he
you had
came up
fun.
with the theme
We're
and
gonna
everything.
do a 90s party this time around.
Okay.
I was
like
gonna
that.
ask you if we could get a sneak peek of the theme, but I'll make sure I get my '90s gear ready.
Oh, we've already hired the band. We have an amazing band for Wednesday evening and called Bella Diva, which is I believe it's 7 pieces.
That's awesome.
3 women, frontline women singers with the whole band. It's part of the same group we had last fall, a little different format that we'll have a blast with it. So
Well, hopefully we'll get Alex out there. I don't know if he's ever been to Minnesota. He grew
I
up in
haven't.
New York. So.
Yeah, that'll definitely be my first time. You know, it's funny. I was just thinking about this. You guys are not the only husband and wife duo that we had on the podcast. So recently, we just had the Starks on the show.
Oh,
Yeah, and we had a great time with them.
yeah, I'm
What-
working
it-
with Derek right now and getting Andrea to the show as well. So that's
It
so
kind of
that'd be
cool.
seems like you have
awesome.
a similar kind of concept where you both stay in your lanes. Where you know the women kind of are more on the policy side, and the men are not. Was there a moment when you guys?
this many policies all at the same time.
Yeah.
There's also policies at home that we have to be wary of as well. So I understand how that can go. Was there ever a moment where you guys realized like, oh wow, we really came a long way together with this business?
Yeah, you know, and especially when you celebrate kind of a 20, well, we did it at 20 years. And then at 25, I was like, all of a sudden was like, oh, how did 25 go so fast? And for so many years, I would say, early on when I was doing a majority of the work, you know, Jim basically now, I mean, for the conferences and stuff, he's taken over so many of the tasks that I used to do. So what I look at, it's just the growth has just been amazing, and it's been kind of a different kind of thing. And like I said, the industry's so different from when I first started that Medicare used to be our biggest problem. Well, now it's all at the state, at the state level, and managed care and Medicare Advantage and all this stuff. And it's just, the amount of work that's being done at the state level far transcends of what we're doing at the federal level. So that, to me, for him being able to take so much off my plate allows me to do that. So it's been great.
For me, it was more when I kind of realized that we were doing something really good was when we we actually signed a contract with Wisconsin as a separate association. And within about 6 months, we're having that discussion that you really, become a part of MAMES. And the fear, anytime that happens, the fear is always that that state is going to lose its identity and that going to be as active or as engaged as we are now. And I think when that group came back after maybe a year and said, this is the best thing we've ever done, we were able to, I think for me, that just showed that we were doing a lot of the right things and able to provide the benefits to those members for them to come back and say, wow, we didn't know, how much more we could actually get done and accomplished. That really kind of hit home for me that we were on the right path and we had created something special for people that was really going to benefit them.
Yeah, I think that goes back to your point of how, a lot of these providers come, some of them are technically competitors, but there's still so much value in collaborating, even if it crosses state lines. And, you guys are probably the biggest regional association. Why do you think collaboration is just so important in our industry for providers or even the state associations?
Well, I will even say, we went to, going back to Jim's mentioning of the Wisconsin Association, WAMES, we had went to their conference before they merged with us. And I was so shocked because I thought, oh, everybody is going to be like a family. And everybody was separated. There was, the people that came, they all sat together. They didn't go to other groups. They didn't. And I was like, this is
It's like a seventh grade prom.
Yeah, that's exactly. It was awkward. And I felt very like, this just doesn't feel right. And then to see these folks join us, and it was like they were two different individuals, and it was like, two different entities, but it was amazing. And I would have never dreamed that whatsoever.
But we preach that a lot. And I think that leadership comes from the board of directors as well. If you ever have the opportunity to sit into one of our board of directors meetings, it's an interesting meeting. I mean, we have an amazing president, and we've been blessed to have a bunch of amazing presidents in a row now. And Matt Flatt is our president now, and for him, the way he starts off a meeting and the way he brings people into the conversations with joking and teasing, and I mean, Matt Flatt and Rick Adamich are like, brothers chipping at each other in a fashion. All they do is tease each other. But I mean, it starts there, and those people will branch out and go find people, and they're amazing from a leadership standpoint. So we're blessed that way. And I think it really shows in that collaboration. I mean, it starts there, and then it goes to the state meetings when they all, at a show, we break down into our state of the states where, those people who are from Iowa will all get together and talk about those things. And it has been easy. There's been states that have fought it for a while. And then as they get a win together, if they get one win together, then all of a sudden it's like, hey, this was a good thing.
Yeah.
We should do this again, and maybe we'll win again. And it's just a snowball type thing. Or they see it in another state where they work together, and then they go, well, we have to do this.
Yeah, but it's kind of like the saying, if you want to go fast, go alone. If you want to go far, go together. So it sounds like
That's a great way to put it.
Love it.
With that being said, go ahead, Alex. Sorry.
All right, I was going to ask, what advice would you give to someone joining this industry right now?
Is you have to get involved. You can't do it by yourself. I get phone calls all the time from, especially like on the associate member side, Jim, I can hear Jim say, what do I get out of it? I'm just doing the show and it's 3 hours long. And, Jim will educate them and saying the show is a very important part of, what it is that you're paying for, but you have to support the association. And this is why. And then he'll go and explain what their funding does to help our DME providers who they sell to be able to be successful in what it is that they do. So it's the relationship building, and it's amazing how many throughout our years of being associate members that really kind of get it. Oh, I've seen you guys in action. I've seen you fight an incontinence program. We're an incontinence provider, and I can see what you did. And now I can work with all the providers in Minnesota to be able to provide incontinence. So it's, educating those folks that even on the sales side, need to know. They need to know what's going on, and we're all partners.
Yeah, you have to get involved.
Yep.
And it, maybe you can't go to DC, but anyone can send an email to their state legislator. Anyone can pick up the phone and call their state legislator and leave that message, or talk to the Health LA and tell their own story. I mean, these people they're just like us. I mean, that other than, they go to Washington, D.C., and maybe they're all, high and mighty or whatever, or think they are, but they're just, you talk to them just like you talk to anybody else if you're adamant or passionate about your business, but you have to get involved. And it does, even if it's not that, it's, getting on a committee. We have people on committee phone calls with Rose who probably haven't said, maybe it takes them 6 months of a committee before they say something. And they're listening and they're learning, and we know they're there. And then all of a sudden, the next thing you know, they're involved in the meeting, and they're bringing active, good things and good conversations to the call. And it's, I mean, I don't know how else to put it. You have to put yourself in.
Well, let's put it
in the
this way.
mix.
Yeah, I'll put it this way. There was a long-time provider. I won't say what state or anything like that, but they knew of MAMES. They knew of MAMES for years, but they only did like one product category. They one day received a letter from an insurance company that says, we're going to cancel your contract. We have a 90-day out clause. And then we're going to send you a new contract that's going to be online for, what's happening on the national level, and right size our contract. So it was a huge, tremendous reduction in reimbursement. So he calls, and just as he's in a panic, and goes, I know you guys have been here, and I don't know if you've heard from anybody else. And, I hadn't. And so, he explains everything that happened. Well, long story short, he literally joined the very next day. He's been active and engaged ever since. We, on his behalf, have sent letters to the insurance that sent him that. In fact, I have a meeting this afternoon with that said insurance to educate them about the DME industry and what a horrible time for them to be, reducing a contract that's below cost in many areas. And so, that happened in a matter of days. And so he just, even in our last committee meeting, he's like, oh my God, thank you guys so much. I don't know why it took me so incredibly long. And he's made a difference already. And we've made a difference on his company. So, in a nutshell, get involved.
Get involved, join MAMES.
Yeah.
I think I got one more question, then we can do our rapid fire round, which will be fun with the both of you. It's a little bit not as serious, but you guys have done so much, a lot of amazing stuff happening. If you can quickly just tell our listeners what's next for MAMES, or what's exciting on the horizon that pumps you guys up.
I would say, it's always like time flies. And so it's always our next event. And so that's what it means, But we did a strategic session a few years ago in Duluth. I mentioned that earlier on in when we first started. And those are the kinds of things that we really look forward to is getting the board together and saying, what can we do? What works well? What doesn't work well? How can we bring more value? Those kinds of things. And we just love those type of sessions. So we have those coming up.
Well, I think the other piece of it for us is, like, Wayne, you've met our daughter, Sarah, who MCs our events for us, which actually started during COVID when we were doing video or online conferences, and Sarah was MCing the events, and we said, well, you're so good at it, now you have to come to the live events and MC the events, and helps me. And at this fall's event, they'll actually be all 4 Schaffhausers at the event as
Oh,
our young-
amazing.
and Mary will be more and more active with us as we continue and grow and go over the course of the next few years. So it's become a family affair, and it's starting with us and bringing Sarah and now Mary. So that's always exciting to see the kids taking interest. And while Sarah's interest is primarily the shows, Mary will become more and more involved with everything we do. So.
And she loves the advocacy side of things. So once she started learning more about what it is you do, she's like, this is amazing. I want to
That's so
learn
awesome.
more.
That's great.
But
Love it.
That's amazing.
Awesome.
Guys.
Let's move on to rapid fire, then we can close this thing out. You guys ready?
all right.
Right.
Okay. All right, here we go. Who's more likely to forget their password?
Me.
He's got 8
Who takes
million
longer?
complex. Depends on the
We all do these days.
what comes.
Who takes longer to get out of the door in the morning?
Rose for sure. I'm always waiting at the door.
Who's the better cook?
Oh yeah, me.
Nice.
What's your
What,
go-to specialty?
yeah, what's your specialty, Jim?
Competence.
I can cook it. Walleye, probably. I make a mean fried walleye. I catch it also.
Ooh,
Awesome.
even better.
You guys got to understand, Rose has cooked 10 meals in 37 years. So 38.
I see this. I see this painting in the background. Who's the better artist?
That's Rose.
Did you paint that?
I did.
Wow.
That's awesome.
That
Yeah,
is
that's
actually the
incredible.
view out our front window, actually.
I think I saw on LinkedIn either the view or the painting of the view. That's awesome.
Rose is an amazing.
who's-
Here, by the way,
Who's more of a rule follower?
Rose.
I am.
It's all about the policies, right?
What? Yes.
Who needs more coffee to survive at a MAMES event?
Me.
Yeah. No. I always have
That's
it ready. I can ask him what time you get up and today because he had an appointment. I'm like, what time do you get up so I can have the coffee ready?
That's awesome. That's a duo right there. Power couple. I love it. Well, I think we got everything we wanted out of the podcast. You guys have been great people to have on. We really appreciate it. If anyone is looking to get in contact with you or is looking to join MAMES, how can they find you?
Well, they can always go to our website at www.mames.com. Our email is info@mames.com, or they can give us a call at 651-351-5395. That's our office phone number for MAMES. So we'd love to have
Awesome.
them. We have a show coming up October 1st through the 3rd right here in Minnesota. We'll have awesome education, an amazing display hall, obviously featuring folks like yourselves as premier partners, and we greatly appreciate that. So, yeah, we'd love to have folks.
That's great. Well, Rose, Jim, thank you guys both so much for coming on the show. We really appreciate it. And if anyone is not yet subscribed to the podcast, we would love for you guys to subscribe. Thanks again for joining. We'll talk to you soon.
Thanks,
Thank
guys.
you.